So should hemodynamics guide treatment? This is the sort of thing the NICAS can do for you. It gives you a nice set of information, set of hemodynamic information that tells you where the patient's sitting. So here we've got a patient in NYHA class 3 with an ejection fraction of 32%, currently receiving pretty decent therapy, perhaps not optimal. You can see that they've got a low cardiac output and a high peripheral resistance. So perhaps we need to do a little bit more for this patient. And the obvious thing to do for this patient would be to switch their ACE to an ARNI, which we did. And as you can see with that, the cardiac output did come up a little bit and the vascular resistance came down. But certainly this patient's still not ideal. So you might say, well, what else could we do for this patient? And this is a sort of patient where if they're still struggling, you might consider further vasodilation and or might even consider digoxin, try and get their cardiac output up. You might feel that there are other hemodynamic patients. But of course, the also shows you that the QRS is quite broad in this patient, so perhaps they would be a candidate for CRT. And